Hi everyone, welcome to my channel which is OET Writing Samples for Nurses from AJ, and today I'm going to discuss a case note of the patient Yanlin Ma. Let's look at the case notes. So right on top it says today's date is 5/4/2012. That means now you have the date on which you are going to write the letter. You are Annie Smith, cardiac nurse at the Prince Charles Hospital, Brisbane. That means you have your name. Your name is given here, the designation is given here. So you need to remember to write it in the end of your letter. Your patient is Yanlin Ma, who underwent emergency cardiothoracic surgery on the 31st of March 2012. Now this is only this much that you need to read in the start, and as soon as you read this, next thing you need to go is reach the end of the case note and read this part under writing task. Now what will you find there? What you will find there, or what you will read there, is this information. What you'll find there: who is the patient and purpose of writing, what do you want the reader to do, to whom you're writing the letter, what type of letter, who is writing, and do they know each other. So write a referral letter. So there itself it says that it's a referral letter. You're going to write to Miss Susan Williams, who is the hospital social worker, requesting her to see your patient before discharge. So the discharge date is given on top. So the social worker needs to come and visit this patient. And what assistance is required? To assist with accommodation, letters for University and Department of Immigration, referral to programs for smoking cessation, and weight loss and exercise. So these are the things which the social worker needs to do. Now if you carefully see, these things are connected to what is written here in the social part. His lease on rental accommodation has recently expired, so that is why accommodation is something that she needs to assist with. He will not complete this semester's university assessment on time, so letters to the university needs to be written. He will not complete, yes, that's what we discussed just now. His visa also expires at the end of semester, so that is why she needs to write to the Department of Immigration. Concerned about being able to lose weight and stop smoking. So referral to programs for smoking cessation and weight loss and exercise. So let's just discuss what are the things that are important or not. So you know that these are the things which are important. This well, let us stop there and go to the starting. Yes. So we have his surgery was done on the 31st of March. So before so this is today's date. His surgery was done on this date. His date of birth is important. He is a Chinese national. He's single. Well, this part is not important, but then yes, this part is important. He doesn't have any family in Australia. He's an international student on scholarship for Masters in Information Technology. Yes, fine. No known allergies, no previous surgery, reports high blood pressure, medications, alcohol use, does not drink. These things are, I feel, not important because you're writing to a social worker who is not going to do all these things or does not need this information. So you have to always keep in mind to whom you're writing the letter. He smokes 5 to 6 cigarettes per day. His weight is this. Family history may or not, so may or may not be required. So you may say it is semi-relevant, but this one smokes 5 to 6 cigarettes. Weight, yes, because in the end we saw that he needs to lose his weight and he needs to stop smoking. So these two things are important. Now he was, I am at the Prince Charles Hospital, Brisbane. So he was presented to Royal Brisbane and Women's Hospital earlier, okay, before he came to my hospital, with severe chest and back pain. CT scan there showed severely dilated ascending aorta and type A dissection. Then he was transferred to my hospital. Isn't it? You see that Prince Charles Hospital here as well. And then an acute pulmonary edema on arrival, echocardiogram performed showing aortic valve incompetence, and then an open chest surgery for repair of this was done. Okay, and now how is he? Now he is satisfactory post-operative recovery. reviewed by physiotherapist. This thing is not important, but yes, this one is important. To be discharged on line 4. So before this date, the social worker needs to come. Okay, so let us look at how the letter is written. Paragraph 1, 2, 3 and 4. Do let me know in the comments box if you have any grammar, if you see any grammar issues, or if you want any help regarding any grammar. Now you'll see how these notes are converted into sentences in the letter, and especially this part connected with this part in the sentences. Alright, so let's look at the letter. So as soon as the letter starts, you have the name and the address without any punctuation marks in the end. You have the date. The date can be written here or in the start. Then we have Dear Miss Williams, that's the last name of the social worker, and the full name of the patient with Mr. or Miss, and born on 12th March 1990. This can be written as date of birth as well, or if the age is given, you can put the date as well. These two sentences can also be, or these two points can also be interchanged. Some places I've seen that RE comes first and then Dear Miss Williams. Some places Dear Miss Williams and RE Mr. Yanlin Ma. So I feel this is a better way of writing it. Now you'll see that this is the first paragraph, and this paragraph actually matches with the information that we have. Now if you see, I'm writing in regards to Mr. Ma. That's the last name of the patient, who was transferred to a hospital 6 days ago. So he was transferred 6 days ago on the 31st of March, and today is the 5th of April. That's the reason why it's written like that, rather than saying all the dates one after the other. And he underwent emergency cardiothoracic surgery. He needs your visit. Whose visit? The social worker's visit, to assist with his health and accommodation before his discharge on 9th April. So you have written most of the things from this. Okay, so the discharge date is there, so 9th of April. So it gives a message to the social worker that she needs to come before this date. And what are the things that needs to be assisted with? Health and accommodation. I'm not writing all these things here. Okay, accommodation, letters for university, Department of Immigration. I'm not writing all these things there. I'm just writing it in short, because otherwise this paragraph will be a huge one, and then there will be no need to read the remaining paragraphs. And that's the reason why here in just 2 or 3 sentences I'm writing the first paragraph, so that the person who's reading it knows that okay, that he or she is the right person to receive this letter, and they know what needs to be done. Now the second paragraph is all what is done in the hospital. So on admission, an open chest surgery was done, okay, 6 days ago, with aortic wall replacement for repair of aortic aneurysm. He is satisfactorily recovering after surgery, so he is recovering. That's the end result. Now about some background information, and the information starts about how or what the social worker needs to help him with. So he's a Chinese student of Masters in Information Technology in Australia. That point comes from here. And then, apart from his mother who has come here urgently, he has no other relatives here. So it says here he doesn't have any family in Australia. And then here it says that somewhere here it says that his mother has come here, and yes, and she does not know English. It's pretty simple. So all those 3 things combined. Remember, in your OET letter, you need to combine 2 to 3 related information in your each sentence, or most of these sentences. You cannot, if you are not good at grammar, try not to include more than 3 points in each sentences. That helps you. Apart from, yes, we did this, he is concerned about his weight and smoking habits. Why? As he is used to smoking 5 to 6 cigarettes daily and has a weight of 105 kgs. So what is his concern? That we have combined. Where do we have that information? Here. This one, and we have combined it with this. Now what do we see next? Then we have, so this was the first paragraph, this is the second paragraph, this is the third one, and this is the request paragraph. So you see that in the request paragraph we have combined this information with this. With this till here, till exercise. So let us see how that is done. I would appreciate if you could visit him before discharge and refer some programs for smoking cessation and weight loss exercises. His lease on rental accommodation is expired and therefore a new accommodation needs to be arranged. His university needs to be informed as he would not be able to complete his university assessment on time. Since his visa expires at the end of this semester, the immigration department needs to be notified. So all those points are combined and written in different sentences, and the way each sentence is written is different. It's not the same. But then yes, the grammar needs to be proper. And in the end, what is it? Please contact me if you have any questions. Yours sincerely. Do not forget this. Your name was given in the starting of the case notes. So here it is, Miss Annie Smith. So you will have to write the same thing there with the designation, nothing more than this. Okay, so your letter is counted till here, from here, and this is a 189 word letter. Alright, so that's what I wanted to discuss, how I would have written this letter. And so that's all for today. If you like this video and want more samples, do click on subscribe and like this video. See you next time. Thank you. Bye bye.